So let's talk about diagnosis. So as you guys know, I created a methodology called DXL Diagnosis-Based Selling back in 2009, and we have been refining it ever since. So when we think about this, and when we're facing a clinician that is a referral partner, here are some of the high value patient types that we really want to focus on. So post-acute orthopedic and joint replacement patients, this is not new, but it is a refocusing of those patients who quite frankly come in a little sick, right after the surgery, and within 10 days time or less, they are functional. They're up, they're moving, they're having a good time, and they're probably back to outpatient pretty quickly, unless they have other comorbidities. But you are a key for that transition. The second one here is CHF, a good old favorite. I think this has been one of my top 5 patients in home health since I was a home health therapist in 1996. So we've had a long history of CHF patients and COPD patients coming from the therapist from Pittsburgh, Pennsylvania. We recognize that COPD was a high value patient and a prolific patient in Pittsburgh. With the steel mills and the coal mills, we had a lot of COPD patients. So recognizing these patients are not new for us, but a renewed focus in how we go about gaining more of them, because we know we can impact them greatly. 2, post-sepsis and complex medical surgery recovers. Now this one might be a little tricky for you. You may go, man, post-sepsis now, really? Yeah. So what we know, these patients come out sick. My father-in-law had sepsis twice this year, came out really sick, needed therapy, really weak, had a whole bunch of new medications, and he was a COPDer on top of that. So recognizing that that is not something that most agencies target, except for our hospice folks. Our hospice folks often look for sepsis as part of their LCDs. But from a home health and home care perspective, it's not something we talk a lot about, but these patients are sick, and it is something that we can help them move through. Just like my father-in-law, twice he came home with sepsis, moved through that recovery period, and was functional again with the help of nursing and therapy. So recognizing this is a great opportunity for you perhaps. And complex medical surgical recoveries. You know, recently I had a friend go through a pretty big surgery, and she was not super functional for about 2 weeks before she started getting around. And we know how important those 2 weeks are in the home. Now, does that mean that it's going to be a 2-week one and done? Probably not. Oftentimes the folks that get referred to us often have comorbidities like my father-in-law, and could benefit from the whole management of the whole person, right? We're patient and person-centered care. So looking at that patient in their totality holistically. And finally, some of my favorite stroke neuro patients with rehab potential. Love these patients. Again, look at the functionality of these patients. Oftentimes they can be longer term patients for our home care friends, our home health friends. I always say I had the opportunity to work in an acute care rehab that I just loved, a head injury unit. And a lot of those patients were stroke patients. And I would share with you, yes, of course, you got the most return in those first 6 months, but we can still get return in what we would call old strokes. So strokes that came in a year post, we're still looking for some functional return and or compensation techniques. So love that about our neuro and stroke patients with some rehab potential. And diabetic patients. The last one here on this list is diabetic patients. Again, a high value target. Diabetic management is so key to all of our service lines. I recognize that with wound risk can even elevate that risk a little bit more for those patients to really need your intervention.